I'd like to call this special meeting of the Senate Finance and Appropriations Committee to order. Would people please sit down? Okay, the purpose of this special meeting is to give members of the Senate, please. The purpose of this meeting is to give members of the Senate who don't currently serve on this committee the opportunity to speak to their own member budget amendment requests. Committee staff will be sharing the budget amendments on the screen so you can see them, and they can also be accessed from the state budget page. It may not surprise you if you've been here before that there are numerous Senate member amendments. In fact, there are 791 of them, totaling almost $11.5 billion. I just will show you. These are the amendments, and I would like to thank staff for putting all this together over the weekend. And we will be going through each and every one of them in due course in our deliberation. So now is the opportunity for members to present to us, and I'd like to start with Senator Reeves.
Thank you, Madam Chair and Mr. Chair, and members of the committee. If it's okay, I'm going to ask Senator Barker if I just tell you the ones we're not going to take up, and you can just scratch them off your list right away. Oh. Item 0, number 10S is DOA. Item 1, number 6S has to deal with establishing the Virginia Gaming Commission, in which we talked about the Wednesday we started. What that would do, real briefly, is allow $250,000 for a joint subcommittee, bicameral, bipartisan, over this next year to allow us to hire consultants so we can go ahead and set up the Virginia Gaming Commission to put all the different silos of gambling in that. Moving forward, item 65, number 1S, you can kill.
You're taking all the fun out of this when you
Is it okay to proceed? Can I
yes,
go? Okay.
Yes.
Item 73, number 1S, is something that Senator Stewart and I have been working on from our county jails, and that's to bring them up at least to a level where they can take care of the inmates and subsidize them. It takes the current rate of $4 per day to $8 per day, which is still lower than what their actual costs are, but it helps them. Item number 106, number 1S, is $50,000 that we just put in for the bill. I don't think it's going to cost money, but that's the Woodrum amendment that we often talk about. Item 111, number 1S, is the part of this study that's going to happen. That's to allow $250,000 for the Virginia Racing Commission to address the needs that were part of the JLARC report that came out to say where HHR was lacking. That will give them the onus to fix those corrections from the JLARC report that are the deficiencies that are happening in HHR. So that's forces them to allow them the opportunity to fix that. Number 125, number 1S, you can kill. Number 135, number 5S, you can kill. Number 137, number 15S, you can kill. Number 137, number 17S, you can kill. Number 188, number 1S, is a request. There'll be 2 requests from the University of Mary Washington, separate. There's 2 separate budget requests for that. I've spoken to Senator Barker about it. When he gets to that time, if he has more questions, he would ask me. Number 215, number 1S. Madam Chair, this came at the request of our Civil Air Patrol and our Virginia Community College system. And I have someone here to speak to that bill and the importance of this and where we're headed with regard to our Virginia Space Grants Consortium. to help with bringing pilots on board, some of our youth, some of the things that they need there. And I can go into more detail, but I know this committee is limited on time.
We, Senator Reeves and everyone else, do not take testimony on these budget amendments.
Got it, okay. Item 311, number 13S, that's the problem gaming committee that myself and Delegate Kriesik has set up. Item 375, number 6S, that's in support of Culpeper State Battlefield to finish those park systems that we have put into place that we said we were going to take care of. Number 380, number 4S came at the last minute from the city of Fredericksburg. You all have helped them tremendously, but we didn't quite finish what they needed for their wastewater treatment plant, so they've asked me to put in that budget amendment for them. You can strike 404, number 10S, number 404, number 13S. Has to do with a bill for anti-Semitism to cover the penalties. I'm not sure that there would be any, but that's just CYA. Item 404, number 36S, you can strike. Item 470, number 2S, is a veterans initiative from the Department of Veterans Services. Has to do with specialty items that help our veterans recover from PTSD and TBI. Item C-1810, number 1S, is the second part of UMW. And Madam Chairman, that is my budget amendments. Thank you.
Okay, and then I believe staff has the sign-up list from here on, so if you could call people in order.
Next up will be Senator Boysko, and if Senator Boysko isn't here, then Senator Lewis.
Not here.
Afternoon, Madam Chair, members of the committee. I'm just going to touch on a few of these because I'm sitting there trying to figure out how I got 22 budget amendments when I swore I wasn't going to have one. And so I'm going to touch on the ones that don't have groups or individuals working on them that will reach out and touch you and discuss it with staff. So, and first among those is item 13712S. This is an item that the committee has considered over the last, I think, 3 years now. And it's a teacher supplement for Accomack and Northampton because of their competition that they have with Worcester County, Maryland, Wicomico County, Maryland, for teachers, for teacher pay. They've been fortunate enough through the good work of this committee to be able to have that supplement for, I think, 3 years now, and they have put great use to it. It is very important to them. Unfortunately, did not make it into the governor's proposed amendments to the budget, but we would like to see that continue, and I'll be providing you all with more detailed information about that disparity and also about how they have made great use of this money in the meantime. Next item, Madam Chair, is 160, number 3S. And this, you may have heard of the fish, the menhaden. This bill, I have legislation on this as well, and there's legislation, or at least a budget amendment, I know, or budget language on the House side. This provides the beginnings of a study to direct VIMS to study whether there is, in fact, localized depletion of the menhaden in Chesapeake Bay. And that is the fundamental question that has brought busloads of people over here for years and years and years and years. Is there localized depletion in the Chesapeake Bay? And so that's what this would seek to finally answer and hopefully maybe put a period at the end of that sentence. We've also got item number 388, number 2S, and that is for the Virginia Marine Resources Commission. We have a large Virginia Marine Resources Commission presence on the eastern shore of Virginia. With the extreme success that we are having and will have with the spaceport, they are the folks who provide offshore security. They have to usher out the sailboats and the fishing boats that come into the no float zone or whatever it is. But it puts a great stress on the resources of the VMRC for other activities, rescue, search and rescue, and things of that nature. So that's to provide them with additional craft for that. We've got one in there, 435 1S, and that's for the Space Flight Authority for hangar construction down in Melfa, which had been authorized, but as with everything else, there's been a cost overrun, and they have a gap there that needs to be filled. And then 115, number 11S, The Hampton Roads Sanitation District is doing a great job providing central sewer to a large swath of the 2 counties on Virginia's eastern shore. This will help them reach the town of Wachapreague, which is important because that's where the new VIMS facility is, the new VIMS lab, fantastic facility there. It's going to be a real jewel. But this would get the town on central sewer. And I think finally we've got language in there, 434 number 2S. This is strictly language. It doesn't ask for any money about transportation resilience plans and use the methodologies outlined in VDOT's initial resilience plan. And Madam Chair, the only other thing I would point out is there are a series of Virginia Delegation Chesapeake Bay Commission amendments. There are 3 of them. One going to wildlife, one going to Department of Ag, one going to DCR, and it's for invasive species, to deal with invasive species. And so that's a Virginia delegation of the Chesapeake Bay Commission priority. So we've got that in there in 3 separate budget amendments. That's it, Madam Chair.
Thank you.
Thank you. Thank the committee.
Next up, we have Senator Boysko.
Good afternoon, Madam Chair, members of the committee. I have a small handful of things that I would like to highlight for you all. First and foremost, I am sponsoring a bill to change the STEP Virginia program. We have some inflation issues, and in order to mitigate the costs, the Virginia CSBs are requesting $8.7 million for ongoing funding for same-day access for primary care screening and outpatient services. This will give them more flexibility. Happy to answer any questions. A second item that I have is a bill that would expand the LECAP eligibility in Virginia. And LECAP, as most of you are aware, we have done a lot in expanding who has access to broadband. This helps get that last few feet from the street to the door, to the home. We have put a cost, excuse me, my brain is getting a little fuzzy. We've put a limit on, it has to be low to moderate income for people to be able to qualify. This would raise that and allow everybody who has a need to apply for the funding to go through that. And then thirdly, I have a bill, a budget amendment to increase the law enforcement positions and funding basing on 1 to 1,500 population. We know that our law enforcement members are not adequately compensated. I also have something for the DOC, something for the compression, and also to bring part-time law enforcement officers into the VRS system, allowing them to qualify. Happy to answer any questions you might have. I have others, but these are the ones that I thought I would share with you all today. Is that enough?
Good afternoon. Let me go through these pretty quick. Starting in order, 35, number 1S, is for funds and AAPI study. We haven't got a FIS on that. It's a placeholder. Second item is 63, 1S. We don't think there's going to be an impact. We haven't got a FIS yet. It's a placeholder. It's on speculative ticketing. Next item is 114, 4S. And 17S, this actually came back saying there's no budget amendment necessary, so that was a placeholder. You can kill that one. 135, 1S, again, no budget amendment necessary. It was a placeholder. You can kill that one as well. 141, 1S, budget amendment not necessary, so you can kill that one as well. 141, 2S, this is related to just giving a code change for security at the Virginia School of Deaf Blind. We don't think there's going to be a need for any budget on that, but it's a placeholder. Restrictive covenants for public parks, number 266, 7S, placeholder. This is just giving Loudoun County permission to purchase a park. Again, don't think there's physical impact. 301, number 1S. This is one that is going to be killed, so we can kill this one as well. We're going to kill that bill for this year. Number 312, 1S. This is budget amendment not necessary, was just a placeholder. 366, 1S. This is a budget amendment not necessary, placeholder. 404, 35S. This one is a construction contract. Department of General Service says that does not have a physical impact, so we can kill that one as well. 494, 1S. This is language only. This bill, frankly, is probably not going to be docketed, so there won't be a physical impact there either. Number 238, 1S, Library of Virginia. The FIS hasn't been received as placeholder. We don't think there's going to be any cost there. 471S, budget amendment not necessary. We can kill that one. 1435, this one was an agency bill. It's not anticipated that there's going to be a fiscal impact on that one. But haven't got anything back yet. 821S, this one is one it's been submitted, but it hasn't been docketed yet, but we don't, so FIS is not available yet. 141.3S, FIS hasn't been released. We don't believe there's any impact on that as well. The couple ones I want to focus on more, item 136, 2S on Learning Ally. This is 2.8 million. I understand that's a larger request. If that were to be reduced, I'm not going to cry about it, but I hope we can get something there. Basically, this is an audiobook solution. We've used it in several districts across Virginia, and it's actually shown to save money because it helps children read early. The early numbers on this are actually quite astonishing, that it shows that students are able to double their reading rate in as little as 50 days. Putting this in some of our more at-risk schools and districts, I think, would have a dramatic impact. And I will point out that this child that's behind at the third grade level tends to cost about 6 times more to help tutor and get caught up and never do. So investing early to help children read, I think, would pay off tremendously. This funding would provide availability for this solution for 60% of K through 12 schools across the Commonwealth. The other one I wanted to point out is the Adler Hospice Center, number 235 3S. This provides $1 million a year. Again, if you do something, anything would be appreciated. This is one of 5 inpatient hospice centers in Virginia. It is critically needed and frankly right now running at a loss. This provides hospice care for children and adults, primarily in Northern Virginia, not just for Loudoun County, but all over Northern Virginia. It is the only one that is a not-for-profit hospice in the area. And they are currently losing about $1.2 million annually. There's a bigger solution needed to this problem, but right now I'm trying to keep the doors open because frankly they provide hospice care to patients that are dying that have nowhere else to go. They are also the largest hospice care center for children on the East Coast. So I think we would be losing a critical resource if this center were to go away. I'm also working with congressional delegation to see if we can get some federal money. I would, going into depth on this just a moment, perhaps if you could do grants for certain categories like veterans and or homeless or others, it would give them a funding source again to keep them alive. I appreciate any creativity staff can provide. I'm trying to keep the door open for this very needed center. The last thing I've got on here is the FACT program. And I know that Senator Barker is aware of this. Sorry, I'm remiss. There's one other in that. Let me go back. Item 313, number 3S, before I go into that one. This is $2.5 million for cannabis use prevention programs. As you know, in the marijuana legislation, originally we had envisioned putting money for prevention. Unfortunately, because of where we're at with that, that hasn't happened. The best practices are when we know that when we know that a change is coming, like for instance legalization of marijuana, having prevention programs ahead of the policy implementation will help. And that's what this tries to do, is try to get some deployment out and across Virginia before we actually have widespread legalization of marijuana and potentially young children getting involved. This would actually provide money to the 40 CSBs. They would each receive $62,500. They would have quite a bit of flexibility how to use it. We could drill down on that. And now let me go back to the last item. This is 408, number 4S, and this is for the FACT program, which is Framework for Addiction Analysis Community Transformation. FACT has been really a critical resource for us, providing data and information. I'm kind of a numbers person, and I chair the Substance Abuse Council. Frankly, one of the most important things is having numbers. Where are we getting overdoses? What kind of information, what kind of overdoses are happening? What are the trends that we can fight? It's hard to know what to fight if we don't know where the problems are. FACT gives us that information. It helps law enforcement, it helps others in this recovery community to fight that. Unfortunately, they've received some grants in the past. They did receive some federal grants. Right now that's drying up, and we're in danger of losing this. If we close this down, then there's going to be a cost of bringing it back, and we're going to lose data in the process. So I've asked for 2023, $725,000, 2024, $2 million. Again, if you can't go that high, I'll appreciate whatever you can do, because I think this is a critical resource to continue to fight addiction and aid in addiction recovery in Virginia. I'm happy to answer any questions you have. I know I was fast.
We actually don't do questions.
That's even, I love those kind. Thank you.
Oh, thank you. Madam Chair, members of the committee, thank you for having me. I know this is your favorite day of the year. If we could start on item 136, number 32S. This is one that I would normally come here and ask for, but you've heard a lot about the shooting at the Rich Neck Elementary School in Newport News. They're an open floor plan and don't have the ability to have classrooms to shut the doors and close off the facility. And so they ask us if we could help them in the short term to get that squared away. Next would be 136, number 40S. This was at the request of the Behavioral Health Commission after a recommendation by JLARC in their pandemic report. This is money to support and provide technical assistance and coaching in schools towards behavioral and mental health. We know we can't get enough counselors in place in the short term. This is trying to provide training to people that we already have there to get as much impact and as much help to them as we possibly can. The next stop will be number 312, number 9S. This starts a series of focuses on workforce. As you know, everybody's having that conversation with us. This is the first stop. We have a provider on the Upper Peninsula called Bacon Street that provides substance abuse and mental health services to adolescents. And they already do clinical hours. You have to do 4,000 you have to do 3,400 hours of clinical to get your license, 2,000 face-to-face hours. This team would allow them to expand their program that they're doing, like the nurse preceptor program that we have, but allowing these folks to get their clinical hours and experience. With this money, they could operate 2 counselors and 1 intern to the tune of about 4,000 face-to-face client meetings a year. They're doing it today. With this supplemental money, we could expand the program and get more people certified and in the street quicker. The next one, 330, number 5S. This committee's been very attentive to the challenge we have with traumatic brain injury. You know, we figure on the peninsula we need about 25 counselors and we have 1. This would continue to put money towards providing another 6, which would have about another 300 patients, may get a little bit more out of them, much over 50, and they just can't keep up with the caseload. Our counselor we put on the peninsula was full in 90 days. The next is number 336, number 1S. I have a bill to try to reconstitute the State Council on Aging, to tighten it up a little, give it a little more focus, and to try to put some more players in. This is a request to have an executive director, so they can have somebody to drive the bus on the program year long, because are any of you aware of their legislative package this year? Well, probably not, because they don't have anybody out there quarterbacking it, and we'd like to have an executive director to do that. Number 340, number 2S, is the beginning of a foster care world. We've talked about kinship care, made great strides in increasing the percentage of children in foster care or keeping them out of foster care because of kinship programs. These are regional programs that have been requested a couple of times but never quite made it, and they would work with the regions of social services to promote kinship care and to try to get these services accordingly distributed. Next, number 345, number 3S. This is both foster care and workforce. This provides stipends up to $10,000 to train people in child welfare and in child protective services. I mean, we just don't have enough people in the jobs or going into the jobs. This would help them with a stipend to get their commensurate training. And then the next one, 345, number 6S, we passed the bill to allow a state kinship foster care and make it one step easier because nobody was doing it because of the federal program. Our state program did it. Last year, we asked for first year money and second to pay, for the first time ever, we're paying a stipend to kinship. We didn't get any. We found about $70,000 in social services money last year, and we think with 200 this year, we can take the next step. Finally, I'm sure, I have two more. Everybody, number 486, number 2S, I'm sure everybody's come to you with their genius proposals about using ARPA money. This is, say, take $5 million, about a little under 10% of what's left in ARPA money, and help our food banks. Inflation is killing our food banks. And so this would set aside $5 million of that money for one-time hits up to $25,000 or no more than 10% of a food bank's budget that they could go to local social services and ask for some help because the price of eggs, for example, have gone up like 10x. So they are struggling mightily. This will use a little bit of that money in that way. Number C460, number 4S, this is planning money for Christopher Newport. Their HVAC, electrical, plumbing, all the trades that take care of the campus are in an old grocery store that is an absolute dump. So it needs to be replaced, but this would be step one of planning for what it would take to replace it. The last one I have is something we've been working really hard with York County to try to help them do some stream restoration, some mitigation. When we built 64 right through Queens Lake neighborhood 50 years ago, we did it the best way we know how from an environmental standpoint. 50, 60 years later, that has built a lot of silt, sediment, and problems from runoff over the years. As we just expanded 64, we did it right. State-of-the-art water runoff, stream restoration work, really did it great. York County has said in their capital improvement plan, in the next 2 years, they'll put up $1.7 million to start recovering and doing some of that work. I'm asking for a 1-to-2 match. And so half of that from the state to put up, since York County has agreed to put money towards fixing the problems that largely stemmed from 60 years of Interstate 64. And I'd like us to give them the 1-to-2 opportunity. Thank you very much for the time, and I appreciate y'all listening.
Hi. Good afternoon, Madam Chair, members of the committee. I'll start with item 42, number 3S. That is a $5 million allocation to increase judicial per diem pay from $250 a day to $500. Judges retire. They're called back to do service. Normally, the clerks will load up their docket to handle that day, and a retired judge will come in and might handle a securities matter, capital murder, whatever. They're only getting $250 a day, irrespective of the number of hours they work that day. So this will increase their per diem to $500. Item 51, number 1S, that's for $3,300,000 will be provided in the second year to support the establishment of a PD office in Henrico County. It will be the 28th Public Defender's Office, and I don't have to go into the efficacy of how successful public defenders' offices have been. The next one is 115, number 10S. It's a fiber network matching funds for the Crater Planning District located in Petersburg. It'll be used in the second year as a matching fund for the construction of a fiber network for an entity located within the Crater Planning District. The next one, 136, number 31S, is a $100,000 allocation for the support of the Lamb Center for Arts and Healing. It's a community-based K-12 arts programming in the Hopewell area. Next one is item 295, number 6S. It is a $3,600,000 allocation. It would establish a cardiovascular disease and hypertension intervention program. I said that quickly, a cardiovascular disease and hypertension intervention program, which will be piloted in the existing school-based health center at Hopewell High School. In addition to having staff members there, including 2 nurse practitioners, they will purchase diagnostic equipment. They will identify high-risk patients. They will engage in case management outreach for the people in this area. This will be in partnership with Virginia Commonwealth University's Health System Parley Heart Center. The cost, I think, is going to be wildly offset by the health savings by getting these individuals diagnosed early. Next one, and if I'm going too fast, okay. Item number 377, number 2S. It's the Waste Diversion Pilot Program, $2 million allocation, and this amendment would provide $2 million for DEQ to develop a waste diversion pilot program. And what this pilot program does is provides grants to public and private partnerships to create and improve existing programs that divert recyclable materials from waste streams in areas including Chesterfield, Henrico, Colonial Heights, Hopewell, Petersburg, and Richmond. Examples of potential projects that are on the radar for this program would be funding new curbside recycling bins, campaign to improve recycling behaviors, infrastructure at the MRF, the Materials Recovery Facility. The program, according to DEQ, is limited in scope, so we can determine its efficacy. We'll see how that program goes to see whether it will continue. Another program that you've heard about before is under item 377, number 3S, the Poor Creek Pharmaceutical Park upgrades. Thank you very much, Madam Chair and Committee, for the monies that you devoted to this Poor Creek Farm. The pharmaceutical park plant will soon become the pharmaceutical ingredients capital on the East Coast. It has been wildly successful. The $29 million that you appropriated last year was hugely beneficial. What does this $5.5 million do? It will increase funding for wastewater upgrades at the Poor Creek Pharmaceutical Park. The pump station and main force were actually constructed in the mid-1970s, so we're approaching almost 45 years. The lack of the capacity right now results in decreased water pressure, which impacts not only residential customer service, but immediately threatens the Bon Secours Southside Medical Center and potentially medical public health crisis. Number 380, number 2S, is a Keep Virginia Beautiful campaign. That request of $150,000 is just to support the organization's litter and recycling campaigns and for administrative expenses. The Western Manor Welcome Center, this is the, in fiscal year 2024, the Historic Hopewell Foundation has maintained this Welcome Center for decades. You can see it if you're on the Appomattox River. If you ever are boating out there and you look up on as my family is almost every weekend, you look up on the hill and you see the beautiful Weston Foundation. This is the second allocation to complete the Welcome Center. Right now they have, in this beautiful manner, they have for functions, porta potties that come in. What this simply does is it will, at the Welcome Center, the Welcome Center will have, in addition to welcoming people to the manor, it will have facilities for plumbing and bathrooms. Item 386, number 18S, is for the Stith Community Center in Sussex, Virginia. What this would do is it would create renovations to the Jefferson Elementary School building. I may have said in the notes it's vacant. It's not. It's currently operating. The community in Sussex County raised money to put a new roof on it, to paint the interior of the building, to improve plumbing, et cetera. A magnificent community endeavor that has already raised almost $200,000 from a relatively small community. This would renovate the Jefferson Elementary School to its full, in order to bring in tenants for the rest of the center. The next bill is a $10 million allocation, and Madam Chair, I'm going to be very candid about it. We put the budget amendment in. There is a bill that has gone through, or is going through judiciary to end isolated confinement or restrictive housing. I quite frankly, and I'll just be honest with you, I've never seen a budget amendment where you're ending a program and it's costing money to end it. When this first came up in the Senate and it was passed, DOC had no problems with it. 10 days later, they said it would cost $10 million to end a program. Just being candid. The Petersburg Police Department is requesting $1,500,000. If you follow the news, there's been an uptick in crime in the Petersburg area. What this would do is provide 10 new vehicles, recruitment, a crime analysis unit, equipment upgrades, and tuition reimbursement for existing members, and also career development. And the next one, I really feel I'm going on a long ways, Madam Chair, but I'm getting near the end. I'm sorry. It's item 452, number 13S. It's for a interchange access report and an operational safety analysis report at Reeves Road. Item 452, number 14S, is the Oak Hill Bridge repair, $2,500,000. And this budget amendment, this bridge was closed in 2022 due to the failing of the corrugated metal pipe culverts and the existing drainage components for the bridge. This is a main artery from Route 301 to the Battlefield Park neighborhood, as well as to the Vernon Johns Middle School and Petersburg High School. It's absolutely necessary. The Lafayette Street Bridge repair is under 452, number 15S, and this allotment of $1,200,000 is for repairs to the Lafayette Street Bridge, which is a historic masonry art style bridge in Petersburg. And the last one, 471, number 3S, is the Fort Lee Museum Enclave. That request of $2.5 million is so that Prince George County can construct the museum enclave to allow the public direct access to the Fort Lee's museums. And the only other thing I'd say, Madam Chair, is that for all of those budget amendments, I have people ready to speak right now on all. I'm just teasing. Just kidding. I wish you could see how quickly she looked up. Madam Chair looked up at me. Thank you, Madam Chair. Thank you, members.
Thank you.
Good afternoon, Madam Chair and members of the committee. Thank you for this opportunity to share some of the budget item requests. I will not talk about each of them, but just highlight a few of them. The first one I'd like to share is item 0, number 9S, and this is to increase the motion picture production tax credit to help Virginia continue to be successful in attracting the motion picture industry to our Commonwealth. In alignment with that also then is item 113, number 2, and this is to establish the Television Production Development Grant Program and Fund. We have a tremendous opportunity here, working together with Virginia Tourism Authority to establish, and also with the assistance of our Virginia Film Office, to begin to award competitive grants to businesses in the television industry for filming or investing in television production here in the Commonwealth. This is an opportunity that impacts many different industries, including the technology sector, including all of our film production areas, and bringing in considerable revenue to the Commonwealth because of the tourism impacts, and allowing our workforce to develop in a different area as well. Item 123, number 1S, is the New Americans Navigator Program, and this would provide funding to establish the New Americans Navigator Program that would distribute grants to nonprofit agencies that provide services to our immigrant communities, assisting entrepreneurs with starting up and growing small businesses in Virginia, including those whose native language is not English. As we know, language is often a massive barrier for many communities, but individuals working to start small businesses face considerable challenges in navigating the system, and this would assist our new Americans in this process. Let me skip to item 211, 1S, and this is to establish a pilot program, assist in establishing pilot program in VCU to provide additional child care specialists located at the child care facilities already in place, the Child Development Center already in place at VCU, adding additional full-time child care specialists to help alleviate the crisis that we have in child care, and especially make it accessible and affordable for staff members with income challenges who would be able then to use those opportunities to continue to work at the institution, but also receive adequate child care for their children. Item 294, number 3S. This is coming from our recommendation from the JCHC. We underwent considerable study this past year in JCHC looking at the crisis that we have in local health departments, and the staffing challenges are directly connected with the lack of competitive pay that we have in our LDH facilities. And so the recommendation out of JCHC is that we provide increased compensation 90% to align with meet 90% of the current industry salary benchmarks in order to be more competitive, in order to attract and retain the workforce that we need in our local health departments. Skipping then to item 344, number 1S. This is also coming out of the recommendation of the Joint Commission on Healthcare, and this is to increase the auxiliary grant rate. Again, research demonstrated that we are facing challenges. Individuals who are in our assisted living facilities, as well as adult foster care homes, are facing challenges because of the low compensation that they receive through the auxiliary grant, and this would raise it to meet expectations not to exceed a maximum rate of $2,500 a month, which would greatly help those individuals who are in our assisted living facilities. And then item 344, number 2S, again, following the same recommendation from the JCHC. This is to increase the personal needs allowance for auxiliary grant recipients to make sure that there is an ability for those recipients to meet the needs that they have for monthly personal care. And this adds supplemental pay moving it from $82 a month to $115 a month. That would enable those individuals to take care of their needs. This personal needs allowance has been flat since 2009, and to meet the cost of inflation and other necessary adjustments, we feel that this would be a benefit that we can support. And I think I have a few more here. Item 458, number 1S. This is to continue the work on the Powhite Parkway extension. This is a request from Chesterfield County, and it is coming out of the efforts that have already been made with our VDOT and our transportation committees to take a look at what we need to do to extend the Powhite Parkway in an appropriate manner and provide a report on its maintenance so that we are able to make sure that we are enhancing the industrial site development in Chesterfield in a manner that is going to be supported by the impact on transportation within that locality, within that region. And Madam Chair, I believe that will conclude what I wanted to present to you. I know there are others, but most of them are related to the bills that have been introduced this session. Thank you.
Good afternoon. Looks like I'm last. Let me see. I'll take the big one first, the very bottom. Thanks. Appreciate that modicum of respect. So the last one, 497. Let's do that one first. This one has to do with the $1.1 billion surplus that VA 529 has right now that Jay Lark studied over the last year. Jay Lark looked at it and found that it was okay for 529 to part with that money. And so basically this bill takes the $1.1 billion, parks it in an endowment, and then says take those earnings and use it to fund about 2,000 scholarships a year to Pell eligible students at 12 of our 15 in-state universities. And it's not, Chap, we'll talk about it. No, it's not. We'll talk about it. And Jay Lark found it wasn't either. But we'll talk about it. But in any event, this is an opportunity for us to create over 2,000 scholarships a year in perpetuity for Virginia and state Pell eligible students, and to help equalize the endowment problems that we have between our universities. The next one I'll do is the other big one that's on there, which is the item number 431-2S, which is body cameras. The Virginia State Police, I think, ought to be the best equipped, best resourced law enforcement agency in the state. And right now, we're, at least in Northern Virginia, we're one of the only ones without body cameras. And when I talk to our state troopers, they want them. It helps them cut through what happens in arrests. Not everything happens on a dash cam picture, on a dash cam. They gave me a quote that it was $48 million to do it. But it saves lives. It saves us liability costs. It's something we need to do. We're asking everybody else in the state's doing it. We ought to be doing it. Then back the very first of my, I'll go down from the top after that. So the first one is a bill I have in its budget language to clean up the historic tax credit. Right now, we cap out how much an individual taxpayer can claim per year on for an historic tax credit at $5 million. For most small projects, that's not a big deal, but we do some big projects, for example, at the Homestead, or there's the White Mill in Danville. There's a project in Norfolk, a $60 million hospital renovation. There's others. And that $5 million cap limits the number of investors that can invest in those projects to make those projects feasible. It doesn't, right now there's no overall cap on how much you can claim in a project. It just means you got to spread it out over multiple years instead of taking more in one year versus another. And this just says, this bill raises that cap to $10 million per year. And it would help facilitate some of these big projects, like I said, like the Homestead or the Dan River or the Dan Mill project, et cetera. Number 6, 1S, this is a bill to juice up our Commission on Utility Regulation and give it 7 full-time staffers like we do for the Joint Commission on Health or the Crime Commission. I think we've done a lot of work on utility regulation and on the utility policy in the last 3 years. And I have a bill pending, which this would provide staff, which would make the CUR have to meet regularly, to take public testimony regularly, to take reports regularly, and will give us some full-time policy staff to help us make energy policy instead of having to rely on government relations professionals all the time. So we have our own policy staff. You know, Dominion's annual revenues are 1/5 of the general fund, and we make bills that move that kind of money around, and we really need, I think, more solid policy help, and we need to make those decisions with our own staff in public more than we do right now. 42.5S raises the substitute judge per diem from, I think, $200 to about $350. I get sub-judges telling me all the time, and judges also, that it's really hard for them to get people to do the sub-judge job for only $200 a day. I don't think that number's been raised in like 20 years or something, or 15 years. It was a Supreme Court priority last year. I think it was in our budget. It wasn't in the House, and I think it came out in conference. So I'm hoping we can do that. Then 274.1S. There's been talk at the federal level about beefing up tax compliance for tax cheats, and this would just appropriate money for us to have more staff to go after more tax cheats. When I've asked DOT before what our return on investment there is, they tell me for every $1 we put in for tax compliance, we get back $5. So to me, that, you know, this really shouldn't even be a net negative. It should be a net positive. But with all the additional volume that's been coming down from the federal government, I think we need to beef up our tax compliance staff. That's what that is. Then just want to highlight 442. Those two ones are Crime Commission suggestions. I'm not going to hit on those, but they came out of the Crime Commission to help with drug and alcohol and impaired driving. My 452.18S. I'm not sure if Senator McPike was here, but McPike has language. He has similar language, basically restricting DOT's focus in Northern Virginia to make sure they focus on the Occoquan bottleneck, which is the worst bottleneck in the United States or in the East Coast. And VDOT seems to be sort of prioritizing other projects ahead of solving that one. And this one basically says that we're not going to look at new hot lanes on the Beltway until we fix the Occoquan bottleneck first. And there's a lot of reasons for that, a lot of policy reasons why this hot lane thing on the Beltway isn't ready yet. There's a contract that was struck when the Wilson Bridge got built that said we're not going to put cars in those lanes. We're going to put rail or transit in those lanes, not hot lanes. But the Occoquan bottleneck, folks, costs Virginians probably $1 billion a year in lost productivity. It's messed up 7 days a week, anytime the sun is up, and often at night. And that really ought to be what the focus is. Then 452.19S. This directs the CTB to provide $25 million if Fairfax County puts up an equivalent amount of money to underground utilities on US 1. And the reason that's there is the state and NVTA are currently investing nearly $1 billion in a transit and roadway improvement project in this area. And the intent is to create some really high-density development. And you don't do high-density development without underground utilities, but VDOT doesn't pay to underground utilities. It's normally something that's funded by the locality. And so this incentivizes Fairfax County to post up some money to get these utilities underground. We're going to have this road completely tore up, and it ought to be done now instead of being done piecemeal at way more expense later, and that's what that one does. And I think that's, I have a couple others that are related to bills, but hopefully you'll favorably act on all those. Thanks.
Thank you. I will be brief. I know I submitted 34 amendments, but I'm only going to speak about 6. So I did put some language in about the free care rule, and this has to do with directing DMAS to set up technical assistance to help our school systems draw down federal money. The Centers for Medicare and Medicaid are now saying they're going to fund services, both mental health and health care, to our students in schools. And many of our school systems don't know how to draw down the money. So I did put that in, and I think it was item 33, number 1S. Item
Senator Favola. You remind me of something that happened to me many, many years ago when I first put in a bill that would do similar to what you're doing, is drawing down more federal money. And the then chair said to me, "Oh, Senator, so that's a sock it to the feds bill." And I will say that to you.
However you want to put this in context to help you get to a point, that would be great of funding it. Yeah, I guess that's it. Sock it to the feds. Item 288, number 1, I did, this is a hospital-based care management program. In fact, Ed and Health just voted on this bill, and you re-referred it to Finance. It came out unanimously this morning from Ed and Health, and it is a recommendation from the Joint Commission on Healthcare. So, again, we're hoping that hospitals will be able to find a way to connect those people, those patients that come to us really needing primary care, but they're using the emergency room. So if hospitals can come up with strategies for helping them get care in the community, that would be great. That's the purpose of that budget amendment. Item 293, number 1, is a home visiting amendment. It's really our early childhood home visiting program, and it's really important that we put some money into this, more money than what we've put in. We call it the Maternal, Infant, and Early Childhood Home Visiting Program, because for every dollar the state puts in, we can draw down $3 in additional funding, and this budget amendment would actually expand our capacity and the number of people served. And I do want you to know that we are focusing most of our visits in high-need areas where there's either high poverty or high percentage of children at risk receiving other services. Item 293, number 3S. This is a grant program to support one of my bills, which is still being negotiated. It's a grant program to help hospitals actually provide security in their emergency departments. We're hoping we can get infrastructure in so at some point law enforcement will not have to maintain custody of those folks on TDOs, because hospitals will have the full capacity to be able to ensure the patient is secure, ensure that staff are secure, and will be able to take the custody of the TDO patient right away. But to get there, we have to set up a grant program and get hospitals moving in that direction. Another budget amendment is 313, item 3, and it deals with children's behavioral health services. And what we did is we asked that I asked that 8.5 million be available, 8.4 million be available to provide crisis intervention services for children, and perhaps other, preventive services and other gaps in the network of care. Item 345, number 5, is the Relative Maintenance Support Program. And this was my foster care prevention program. And it's the second year that the Finance Committee will have approved funding for this and sent it over to the House. I now believe everybody understands the program. This program will support parents who are a relative or victim kin to the child who would otherwise have to go into the foster care system. But they would have an opportunity to stay with family members, but the family needs support. So this amendment would ensure that dollars will be made available through various programs. Some families might be eligible for TANF, some families might be eligible for state dollars. There may be a number of revenue streams, and I just want to make sure we have enough revenue in the budget. We did have money last year in the Relative Maintenance Payment Program. According to DSS, we had about 4.5 million. But I don't know what the actual amount is now. And this will support my bill, Senate Bill 923, and we put language in my bill which says that when the money runs out, it runs out. So we'll only support families as long as we have the money in the budget. So it's not an open-ended entitlement by any means. And then lastly, I have something from the Commission on Youth, item 130, number 1S. And this is actually Department of Education and Inter-Community Transition Council. We're trying to encourage, I guess is the right word, the Department of Aging Rehabilitative Services and the Department of Behavioral Health to actually set up a transition council to help those who are transitioning out of the public schools into the workforce. And these would be our children with, disabilities or challenges. And I have a Department of Education Transition Coordinator Grant Program, which, again, we're trying to increase funding in the Department of Education so they can work with all of our school systems to ensure that our youth who are exiting the public schools and have our special needs have some support and pathways forward to employment or further education. So I will complete, that completes my presentation. I guess you're getting the drift of where my interests are and what I want to support. And I appreciate your attention and your hard work, so thank you very much.
Thank you, Senator Favola. Oh, Senator Suderline, you just made it. I was just going to have us rise.
I would like to highlight 136. All of these are good, but the other ones you will get to see in bill form. This one is one that is important to the Roanoke Valley. It's specifically for new CTE education infrastructure in Roanoke. As you can see on there, it would provide for a new health science lab, incorporating sports medicine. As you know, healthcare is our largest employment sector in the Roanoke Valley, so it's especially important that we have more folks in training for that as early as possible. Also, engineering and robotics. We have friends over in Botetourt in the robotics sector, and building trades, which is obviously necessary everywhere. So I don't want to trespass on your time, but I wanted to make sure that you know this is incredibly important. You see, I don't put in a lot of different spending amendments, but this is something that's very important to us in Roanoke.
Okay, thank you.
Thank you very much.
Thank you. Is there anyone else? No? Okay, then the committee will rise.